Hi, my name is Christian Accomando, and I'll be presenting this project, How do Mindfulness Meditation and Trait Mindfulness Relate to State Anxiety? I worked on this project as a research assistant in the Emotion Regulation Lab, along with my mentors, DeLoretta and Dr. Elizabeth Davis. Anxiety is a regular occurrence for many of us and can be a hindrance to everyday life. So today I'm going to talk about how mindfulness meditation may be able to help anxiety. Mindfulness meditation consists of consciously placing one's attention on present moment experiences in an open-minded and non-judgmental manner. It has been shown to be an effective method of reducing state anxiety, which is a transient state of negative emotions in response to specific situations. Trait mindfulness, one's ability to be mindful in everyday life, is also negatively correlated with state anxiety. Not much is known about how these three variables interact with each other. Our research question asks how trait mindfulness and practicing mindfulness meditation relate to state anxiety. In line with the current body of knowledge, we hypothesized that participants assigned to practice mindfulness meditation will show a greater decrease in state anxiety over the course of the study than those assigned to a control condition. We also expect that participants with higher trait mindfulness will experience a greater reduction of state anxiety compared to those with lower trait mindfulness. 210 undergraduate students participated in this study. They first completed self-report surveys on trait mindfulness and state anxiety, then were randomly assigned to either a meditation or a control condition, where they were to relax by themselves and listen to a 15-minute audio recording. Once finished with the audio, all participants filled out the state anxiety survey for the second time. Trait mindfulness was measured using the Freiburg Mindfulness Inventory, a 14-item survey that has its participants rate how much each statement applies to them over the past week. This survey treats trait mindfulness as its own construct by focusing on a single overall score rather than a compilation of subscales. State anxiety was measured using the State Trait Anxiety Inventory, where participants were asked to indicate how much they agree with each statement in the current moment. Participants in the meditation condition listened to a guided mindfulness meditation audio that focuses on controlled breathing and letting thoughts flow in and out of the mind. Those in the control group listened to an audio about the Hubble telescope. The audio was designed so that it sounds very similar to the audio from the mindfulness group. Pre-manipulation reports of all participants show a moderately positive correlation between trait mindfulness and state anxiety. This finding opposes the current body of knowledge on the subject and may indicate outside factors being at play. Also contrary to current research and to our hypothesis, the change in state anxiety for the meditation and control groups showed no significant differences. Lastly, we ran a linear regression model for each of the two groups, controlling for state anxiety. On the slide are scatter plots for trait mindfulness and changing state anxiety for each condition. Trait mindfulness was found to be a significant predictor of greater increases in state anxiety for those in the meditation group, while the control group indicated no such interactions. This means that participants with higher trait mindfulness showed more reported state anxiety than those with lower trait mindfulness. Since trait mindfulness predicted increased state anxiety, these results starkly oppose our initial hypothesis. One possible explanation lies within the Freiburg Mindfulness Inventory. Since it attempts to analyze trait mindfulness as a whole rather than the sum of multiple parts, certain statements may not be variables suited to this project. For example, the statement, "I sense my body, whether eating, cooking, cleaning, or talking," can be perceived differently based on many factors, anxiety included. Evidence for this can be seen in the precondition correlations, as trait mindfulness and state anxiety showed a moderately positive correlation. Both the size of the original study and the audio method of meditation give rise to potential confounds. With that in mind, future research should focus on more attention on the contextual and individual factors relating to mindfulness meditation and state anxiety, in the hopes that the practice becomes increasingly effective for a larger audience. We plan to dive deeper into the relationships between the variables in this study, as well as integrating in more variables from the original study, like self-compassion and emotion regulation strategies. Thank you for your time and attention.